Hi, I'm Jim Berkland, editor of McKnight's Long-Term Care News, and I'm here with Rick Miller, outgoing board chair of the American Healthcare Association at the group's 60th annual meeting in Chicago. Now, Rick, you've been leading over 2 very significant years. What do you see as the highlight of that time?
Well, we've had a lot of accomplishments, and I think taken together, the fact that we've brought a lot of value to our members in terms of the return on investment that they're getting for the dues that they've paid us. Like I said in the meeting earlier today, for every dollar invested, our members are getting $182 back in terms of Medicare, Medicaid, cost savings, and those kind of things. So I think being part of an organization where we can actually show that we're providing a value for the member, I feel really good about that. It's a good return on their investment.
Certainly. Now, as there are different advocacy efforts and things that the association pursues, not everything has gone according to plan. In the broader scope of things, what has been the biggest challenge or maybe disappointment of that time that wasn't quite achieved?
It's a good question. I think the one of the objectives that we set out to do 2 years ago is to bring the Alliance and the association, AHCA, back together. And I think that we've made a lot of progress in bridging the gap and the differences between the two organizations. But not having that happen by the end of this year was a big disappointment. I'd say the level of cooperation and respect between the two organizations has never been better, and I think that by the end of the next year we'll see that happen. But to have it, to not follow through is the biggest disappointment.
Well, now the Alliance for Quality Nursing Home Care, what you're referring to, of course, with the association, what are you working on now that we might see fruits of the labor coming in the near future? Certainly there's certain big advocacy efforts, I think, that you might be working on.
Well, I mean, certainly we're working cooperatively on the Save Our Seniors campaign. We worked very, very well together on in developing the new quality agenda. And I think that, I think candidly that the larger members of the association that are members of both groups are seeing that there's probably not a reason to duplicate fees and effort. And candidly, we're faced with an unprecedented amount of challenges in this next couple of years. And I think we all understand, I think the Alliance and the association understand that we're better off with a common voice, a common vision, and having a single organization means probably fewer missteps and an improved probability that we're going to be successful in getting through next year's challenges.
Okay, great. And looking forward to the individual operator or member or provider out there, what do you see for the future for them? What is the challenge there? What would you like to see going forward?
I think that the profession that we're in is changing very rapidly. And this is I'm speaking as a provider, not the chair of AHCA now. And I think what we're seeing is throughout our country, we're seeing the rejection of the typical long-term care model, long-term care being provided in old nursing facilities. And I think that change represents a challenge to those that aren't willing to embrace the fact that probably the future nursing homes are going to provide primarily short-term stay, and that for the most part, long-term care is going to be provided at either home or in some community-based care setting. And for those that embrace that change, I think there's an unprecedented growth opportunity in their future.
Well, great. Appreciate it, Rick. Thank you very much.
Thank you.